her up. It would fill up all the way into this blanket of the bar. Comes out over the story. Then I'm gonna kick it back. Punch it in. Squish that in here. Right, turn it all out. With this. And that. Next. Unkink. Let it go. Kick it back. I'm just gonna get to do it by hand, because I've got more control over it. Take it, push it in here, put it back in there, hold on, start to pop off. Now I'm gonna measure my residual. It's not more than 150, so let's go back and continue with the feeding. Then get out a pH strip. And stick it in here. Good, I'm gonna shake it. It's normal. Then I'm gonna throw this away. Put that down. Now I'm gonna turn the residual. It really does. Like, that's all the G-tube that you got. Now, the other one we can make it in honey. I've got this. Open it up. I've got a feet. Take this. Stick it down here. Squish all this back up. Let's go.
Okay, we're about to start our skill and G.
Sink it. Squish it all in.
Alright, so before we enter the patient's room, we are going to check the orders. We have orders to insert an NG tube,
Suck more.
connect to intermittent mobile suction. They're going to be NPO afterwards, so we'll make sure we educate them on that.
Still going
And we're going to flush with 50 milliliters of water.
Look at that.
It's signed by the physician, it's for Ms. Valerie Jones, everything adds up. It's signed, same allergies, same birthday. So, we're ready to enter the patient's room.
I'm not gonna do that right
So
now.
we've checked our orders,
I'm
so
going to then
now we're
check
gonna
my
go in the
order
room.
one more time, make sure that this is not correct.
Hello, Mrs. Jones, my name is Jared, I'm gonna be the next one here today. We have orders to start NG tube, can you tell me your name and date of birth?
That's correct.
So she tells me her name and date of birth.
I'm gonna go ahead and.
It matches what was on the order. So now I'm gonna ask to see her wristband.
Disconnect this, I want my hangover.
So she is the same patient, so now I'm gonna do some hand hygiene, I'm gonna get some gloves. And while I put on my gloves, I'm gonna ask, Ms. Jones, do you have any allergies that you're aware of? Specifically to iodine, betadine, or shellfish? She says no. She doesn't have any allergies at all. I'm gonna ask her, have you ever had an NG tube before? She says no. Have you ever had any trauma to your nose, nasal surgeries, anything of that nature? She also says no. So with that being said, I'm gonna educate her on the procedure and what to expect. I'm gonna tell her that she will be NPO afterwards, so she should keep nothing by mouth.
Once I get all the feeding in, sit there to the side.
Now we are ready to begin. So first things first, we're going to inspect her abdominal area. So Ms. Jones, I'm gonna have to expose you for a second. I'm gonna do it in the least invasive way possible. We're gonna expose all 4 quadrants. We're going to look first, look for any abnormalities, any abrasions, lumps. It all looks normal. Ask her about her bowel habits. How often do you use the restroom? What consistency is it? Is this normal for you? Okay. So it all adds up. Do you have any tenderness? She says no. So now that we've looked over the area and we've asked those questions, we're ready to listen and for bowel sounds on all 4 quadrants. So we're gonna do that. Present. Present.
Alright, Ms. Jones, we're all
Present.
done. Tell her that she did a good job.
Present. So it's present in all 4 quadrants. If it wasn't, we wait up to 5 minutes. Now we're gonna listen for a bruit with the bell of our stethoscope.
Take off my gloves, wash my hands.
No bruit is present, so we're good to start. But before I cover the patient up all the way, we are going to palpate. We're going to go in the way that we auscultated. She said she did not have any tenderness. If she did, we would save that area for last. It all feels normal. So now we're ready to start. So if needed, I would change gloves at this point. My gloves are not soiled, so we're going to
Don't, like, if you feel like
So I'm going to raise Miss Jones's head to 30 degrees.
And just, or if you have to, just do this, and I'll try to figure out what you're doing, but don't let me get ahead of myself, because I do it.
I'm gonna ensure the head is up. We've already gathered our supplies. We have our NG2, our bolt syringe, our water. We have our pin, our lube. So before we get started, Miss Jones, I'm just gonna check the patency of your nares, see which nostril would be a better fit. And again, you said you had no nasal trauma, correct? No nasal surgery? Take a deep breath. That nostril. Into this one. And can you open your mouth for me? So both nares are patent. Now, Miss Jones, I'm going to check for a gag reflex. Just stick your tongue out, say ah. I'm gonna poke the uvula in the back of the throat. She gags. It's present. So, with all that being said, I think we are ready to start. So I'm gonna open my materials. We have our cup of water. We have our bolt syringe. Which I will go ahead and put 50 mLs of water. So we have 50 mLs of water inside of our bolt syringe. We have our drape. I'm gonna go ahead and drape the patient. And we filled this with the water. This is tap water for her to drink on while she gets the tube placed. So we are going to open our NG2. I'm going to go ahead and measure this real quick. I'm going to get some tape here. And at this point, before I got started, I would also label my containers with my initials and the date. Okay, so now that I have my tape ready, I'm going to go ahead and measure my G2 before we insert. So we're going to take the tip of the tube to the back of the ear and the nostril. And we're going to go from the ear down to the xiphoid process. It should be about 56, 57 inches on average. We got 57 for Mrs. Jones. I'm going to put our tape on here to mark it. Alright, so now that we've marked our G-tube after we measured it, we're going to place it in some lubricant, get it prepared. Look for a brewery. Now that we have everything ready, we have our tube all lubricated. I'm going to use this as lubricant for the mannequin. In real life, you use actual lubricant, water-based. So if she did, I'll take that last. For safety measures. We have sprayed the nares with the lubricant. We are going to get the cup of water, and we're going to, if the patient can do this, we're going to have them hold it, and we're going to tell them if they're going to need to swallow as we insert the tube. I'm going to say swallow, swallow, and they would drink. It's to help keep the epiglottis closed in the throat,
So now I'm going to listen to each one.
and it helps correct the tooth placement. So we are ready to insert. We're going to give our water to our patient. They're gonna have it up to their mouth, ready to drink. Okay, you're gonna feel a lot of pressure. It's gonna be uncomfortable. Can you tilt your head forward for me? They're gonna tilt their head forward, and we're gonna have them swallow as we insert. Here we go. 1, 2. Swallow. 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 And if we meet resistance, we would stop, and we would either pull out or slowly continue. Pull out and restart. And we're gonna watch vital signs. If it has a sudden drop, we will stop and restart because that means that it could be going into the lungs.
Or a early, which is like a swooshing sound, which is abnormal.
Swallow, 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 swallow. So we would go all the way to the tape marker, and then the person, mannequin's giving me a little resistance, so I'm going to stop, and I'm gonna act like it went to the tape.
What kind of stuff she eats.
So, now that we're here, I'm going to temporarily tape it to the face.
I'm gonna ask her if she has any pain. I'm also gonna check her with downstairs. While I push in, she has no pain. Well, she feels pain. And she doesn't have any, so that's good.
I will move this out of the way. We will take our tube.
I'm gonna run high power until she's 60 to 90 degrees.
And now we will pin it to the gown. Not through the tube, through the tape. Now that we've done that, the very first thing we're gonna do, we are gonna call X-ray and have them come look, but as soon as we get it in, we are going to check the back of the throat, look for the tube,
Might tilt you back just a little bit.
and then check the nares. And now that that's in, that looks good, we're gonna listen to some breath sounds first. They should be clear and present. So listen to the lungs. We gotta have clear breath sounds. So now we're immediately going to call X-ray and have them come verify placement. So X-rays here, they verify placement. So we are good to flush and hook up to intermittent low wall suction. So, since that was confirmed, we are going to take our 50 ml of water that we have prepared. We are going to put it in here, and we are going to flush. So we push the full 50 ml.
I'm going to wash my hands.
We're gonna uncap, pink it as necessary, try and prevent any fluids from getting out. And we will connect to suction, and we will set it to intermittent low wall. So now that's in the patient, we have it hooked up to suction. We're gonna ask the patient if they need anything. We're gonna put the bed down and clean up our area, tell them we'll be back soon to check on them. We will note what the suction draws out of the patient, because we will have to document that. If they don't need anything, we'll put the bed all the way down, provide for privacy, hand hygiene after we cleaned up our area, and then we'll go record. For today's sake, we also have orders to discontinue the suction. So we're gonna come in, patient already knows who we are, we've identified ourselves, we did our identifiers, no allergies, everything matched up. We have the orders to discontinue the suction, we've done hand hygiene, put on clean gloves, and we are going to drape this over the patient. And we are going to remove the tubing. So we're going to tell the patient, hey, I'm Jared, I'm going to be your nurse today, I'm here to remove your tubing. We're going to turn off the suction and then disconnect. We will note whatever drainage is in the canister because we will need to chart that and how the patient tolerates these procedures. So we're going to unpin it from the gown.
it
I'm
is,
going to then
as that's
get my
coming on, I'll make sure that
actually,
I'm
let me get my tape real
listening.
quick.
I'm doing tape.
Now we're gonna remove the tape.
We're gonna do that while I'm over you.
And we would have removed this facial tape that was just temporary.
Listen here, make sure that it's in line.
And now we're gonna remove the
Area.
tube. This is gonna be uncomfortable. Just take some deep breaths. We're gonna remove.
So I've got 3 pieces of tape.
And after we get the tube out, we're gonna place it in our gloved hand.
Good thing. So from here, I'm waiting for X-rays.
And we are going to remove the glove. Try our best to fit it in the glove.
Marking area right underneath,
So,
make sure that it
what I'm
doesn't
gonna
move,
do
make sure I know
is
right
I'm
where it
going
is.
to hand you to them.
And we will
X-rays and
discard
stuff, and
the tube.
it's in the right place. I will begin to
The
flush
patient, if they need
area,
anything,
flush the NG
note-
tube.
notify how well they tolerated the procedure. We're gonna check the drainage that they had, because we will need to document that. We're going to place the bed down.
Trachea.
Make sure that it's pinched up.
So I'm gonna grab the tube here.
While they had the tube in, they would need their head to the bed at 30 degrees, and we've already educated on NPO, but would make sure we did that as well. So now that that's out, we're gonna ask patient, do they need anything? We're gonna clean up our area, we're gonna do hand hygiene, tell them we'll be back to check on them in a little bit, and we're gonna go document and make sure we see how they tolerated the procedure, what it looked like, how much drainage we got out of the canister, and if there was any issues.
I will hook it up to the low section.
So, I'm gonna explain to her that as the dean just did, and I'm gonna explain to her that she needs to swallow. And she needs to-
Down here, I would make sure that you know that the head of the bed is say 30 degrees, and make sure that she's making she's NPO, and she's on the input output. Okay, let's try whenever it's time to disconnect. Come back, make sure. she
Okay,
knows
so
the procedure.
now we're on to the tube feed part of the skill. So before we entered the room, we would check our orders. So we have one can of Jevity, we have our one can of Jevity, 1.5 every 4 hours through the peg tube. We need to flush with 50 milliliters of water after the feeding. So we have all that ready. We're gonna check the gastric residuals. We will do this before we get the feeding, and we will check the pH, and we're gonna notify the physician if it's over 150 milliliters. It's signed, it's for Miss Valerie Jones. She has no known allergies, that adds up. So that being said, we're ready to enter the rooms, we dinner. Hi, Miss Jones, my name's Jared, I'm gonna be your nurse today. She's coming in date of birth, I'll check her wristband. Do you have any allergies that you are aware of? I am here to give you your feeding. She says, okay. So we are ready to start. I'm gonna do hand hygiene and I'm gonna glove up. And the first thing I'm gonna do is, well, I'd instruct her on what I was doing first and foremost, but I'm going to look at her tube site. So I will lay her back for this.
I'll have you back. I'll make sure that I educate her.
We're gonna look at the tube site.
Make sure she has phone.
We're gonna note any scar tissue, bruising, abnormalities. Are you having any pain here, Mrs. Jones? Is anything bothering you? Do you have any tenderness? How often are you having your bowel movements? Is that regular for you?
And I'll go ahead and start my next.
So it looks normal, so it looks good. If the dressing was dirty, we could go ahead and change it now and apply clean dressing. Everything looks good. It is clean and intact. So that being said, we are ready to start. So we're gonna open our supplies. We've already educated Ms. Jones on what we're doing.
We're gonna be doing a peg tube feeding.
We're going to open this. Our ball syringe. We're going to prepare it. We have our sterile water, or it's not sterile, it doesn't have to be sterile, it's not a sterile skill. So we're gonna open the water up, we're not gonna get that out just yet. We have our pH strips. We have a drape. I'm gonna go ahead and place this drape under Mrs. Jones right here, just in case it has any spillage. And we are going to check her residual now. So to check residual, we're going to put the head of the bed up. Before we draw any residual, 30 degrees. Okay. So now that it's up 30 degrees, at least 30 degrees, we are going to go ahead and put a kink in here and unclamp.
First thing I'll do is.
And then we are going to insert syringe and we're going to let it fill up with residual. And we will clamp this, squirt residual into our canister here. We will redo the process until we have all of the residual out of the patient. That being said, we're going to clamp this after, and then release the kink. So we have all of her residual here. We're going to first off measure residual. It's about 100 mLs, so it's not over that 150 mark, so we don't have to notify the provider. We're going to go ahead and check our pH. We have pH strips here. So I'm going to dip it in. I'm going to check the pH.
Less than 150.
Her pH is normal. That's good. So now we're ready to move on. So we're going to remember to replace the residual into the patient because that is vital for fluid and electrolyte balance. So we are going to repeat what we did, but in reverse. So we're going to unclamp this. We're going to have it kinked off so we can put the residual back. So we fill this up with residual. Push in, kink off, fill it up, push in, off. And we're going to kink and clamp. Alright. So now that the residual is back in, we've checked the pH. The residual was a fair amount. It wasn't too much. We are ready to give the feeding. So we're going to start by getting this ready. We have our Jevity here. We're going to go ahead and clean the top with the alcohol swab. We're going to remove the top of this syringe. So now it is about ready to begin. We're going to feed slowly. If too quick, it may cause cramping, and if it does, we need to slow down or take off the tubing and wait a few minutes because you don't want to cause discomfort to the patient. So we are ready to begin. I'm going to take my syringe. I'm going to attach it here. I'm going to unkink the tubing. I'm going to hold it straight up. We're going to open the Jevity that we've cleaned off with the alcohol swab. We're going to slowly pour in the amount that we need. And we can hold it lower if we need it to go slower, or we can kink it off if we had to. But I'm just going to hold it straight up. She's tolerating it well. We give her whole feeding. So then we're going to clamp this off after she's had the whole feeding. Take off our syringe. So that is done. Now at this point, if we needed to, we could change gloves. My gloves are still clean. So we're going to reconnect the end of this syringe. And we are going to get 50 mLs of water. She tolerated the feeding well. You always flush with water. It's important to do that so the tubing does not get clogged.
You don't have to squeeze it.
So we're going to open our water.
Don't squeeze it when you get it, because you'll squish it all right down in there.
We're going to get 50 milliliters. So we have 50 milliliters drawn in this tube. So we're going to unclamp and kink, insert, unkink, and fill flush with 50 mLs of water. It flushes easy, it's a clean flush. We're going to disconnect, kink off, and reclamp our tube. Now that she's had her feeding and we have flushed, checked pH on the residual, all of that stuff, we are about finished. We're going to ask Ms. Jones if she needs anything as we start to clean up our area and toss things as we go. So the site is good. We clean it if we needed to. It's been flushed. We're gonna cover the patient back up, we don't wanna leave her exposed. We're gonna leave the head of the bed up at 30 degrees, we're gonna educate her that that's important, especially after feeding, to prevent aspiration. So we're just gonna ensure it's at 30 degrees. We're gonna lower the bed down to a comfortable level. We're gonna make sure Miss Jones has her call light. I'm going to, after my area is cleaned up, I'm gonna take off my gloves and wash my hands. And if she doesn't need anything, we're gonna remind Miss Jones, I will be back in a little bit to check on you. And we'll go hand hygiene and go document thoroughly the tolerated procedure, how it went, and so.
I've got a towel here. Gonna lay that down. So I'm gonna check the guilty and make sure.
Now I'm going to clean my area.
It looks good. And the alcohol wipe and so, no. I'm gonna check for anything discomfort and use that to help you know how great I am. Clamp it. The bolts are in the back. What is that? Thanks for everything, and I'm gonna put a little bit of water in it. Check on her, I'm also gonna make sure the head of the bed is at least 30 degrees. And let her know that I'll be back in about half an hour to check on it, and then we'll check in for about the price and go down. Now, I will